Good morning and welcome to Veterans Heartbeat on the Pulse of the Veteran, where we discuss issues of health, happiness, opportunity, and well-being of interest to the veteran community, their families, and the community who honors them.
Good morning and welcome to another episode of Veterans Heartbeat, brought to you by River, the Rural Institute for Veterans Education and Research. My name is Jason Zencraft. My co-host Ed Lasofsky is here with me, and he is the Executive Director of River. We welcome you to a weekly wide-ranging discussion of issues, events, opportunities, and needs in our veteran community. Morning, Ed. How you doing?
Morning, Jason.
We'd also like to thank our sponsor, Farside Signs. They create amazing-looking vehicle graphics that will drive traffic to your business. They are located at 1526 South Avenue West in Missoula. Follow them on the web, Instagram, and Facebook, or just stop on by.
So, Jason, this morning we have two guests we've been talking to over the last few episodes. We've been talking to Jesse Ramos about the $25 million that he discovered was not being declared within the city budget. But more importantly, we have the Director of Policy for Concerned Veterans for America. So we have Dan Caldwell here with us this morning. And good morning, gentlemen.
Morning, Ed. Thank you for having me on.
Our audience knows Jesse. They know that he's been fighting for the veterans out there, but we don't know what Concerned Veterans for America is, and I know that you just opened up field operations here. We're excited to find out what you're bringing to the table for the veterans here in Montana. Go ahead and tell us, would you, Dan?
Sure. So Concerned Veterans for America is a veterans advocacy organization. What we mean by that is that we are focused on advancing policies at the federal, state, and local level that will help veterans. There's a lot of great veteran service organizations and veteran charities and support groups out there, and we didn't want to try and replicate a lot of good stuff that's already happening, including there in Montana with some of the groups that you all work with and other places as well. When we were founded back in 2012, we saw a gap in that there wasn't a permanent, perpetual veterans organization that was focused on advancing a set of policies, specifically to reforming the VA and Department of Defense, that could really go out there and focus 100% of its effort on pressuring lawmakers, organizing activists, and holding people accountable when they did the wrong thing. So our mission is to preserve the freedom and prosperity we fought and sacrificed for while in uniform, and we do that by advocating for policies we feel will fix things like the DOD, the VA, and ultimately things like our national debt, which is a huge threat to our future as a country. So we're fighting for a wide range of policies that will benefit not just veterans, but all Americans.
Well, you're a combat vet yourself. Is that correct, Dan?
Yes, I served in Iraq with the Marine Corps. And when I was there, our EOD team was Navy, and they were some incredible sailors, and I loved working with them.
You talk about fiscal financial responsibility. Jesse's been fighting the budget here in Missoula, and veterans are getting forced out of their houses in some cases with the high price of the taxes in the city. Jesse, you want to hit that a little bit?
Yeah, so first of all, I just want to thank you for coming on. It's been great to hear from you, and I'm hoping to learn more from CVA as I move along. And if I'm fortunate enough to be elected, I'd love to hear some feedback as to what other cities and municipalities are doing around the country to help veterans, because as it stands right now, the city has $209 million of total appropriations, and we don't spend a nickel specifically to veterans, and that doesn't seem right to me at all. So as Ed mentioned, we're working on what's called a Veterans Advisory Council, and I'm sure you're familiar with that, but the city council has actually been fairly receptive to the idea, a gal in particular, Annalise Hedal, and we're just looking for any sort of feedback and any guidance that you could give us on how we can make the most effective program to help the veterans.
That's great to hear, and there's a lot of things that can be done, both the state, federal, and local level. But I think that one of the most important things is, to implement policies that benefit not just veterans but all the residents of a particular state. or town. Creating opportunities for all, benefits, us all too, and ensuring that veterans are connected with the benefits that they've earned while in service is the best thing that I think a city and state can do, because a lot of times they don't realize what benefits they have, and just accessing those brings a lot of benefits to both the veteran and the locality as well.
Well, Dan, you've been working on this issue for a few years now. It seems like our organization, the Institute, River, opened up about the same year that CVA did. So it's kind of an interesting effect. We work really hard on veteran suicide, and we work real hard on trying to bring in health care for the rural veterans. We have some veterans that have to drive 5 hours one way for any kind of care. Can you tell me what you're advocating in those situations?
Well, for the longest time, the VA, frankly, didn't even really try to address this problem. And their solution was to build, in many cases, CBOCs, community-based outpatient clinics. And they would try to build these in more rural areas. But these CBOCs did not provide a lot of services. I'm not joking when I say this. Some of them couldn't even give you an aspirin. And in some cases, they're only open 2-3 days a week. So they didn't really increase access to health care for most veterans. And in 2014, after the VA waitlist scandal began, Congress created the VA Choice Card, which was specifically designed to help veterans that lived long distances from VA facilities. However, the way it was implemented, and I talked to Sam Redfern, who's our new director out there in Montana about this, because the CBOCs were counted as VA facilities, it really limited choice for a lot of veterans that should have qualified for choice. And in rural areas, that kind of hurt them. So the choice program had good intentions. It has helped some vets, but mostly it hasn't been really applied and implemented properly. So what we have advocated for is increasing choice and giving veterans true choice. So you're removing these lines of 40-mile and then the 30-day wait period if you're on a wait list for 30 days, and that's when you qualify for choice, and giving every veteran who uses the VA the ability to take their benefits in the private sector if that's what they choose. Now, for a lot of veterans in some rural areas, like I'm from Arizona, so I kind of use that as an example, they would be able to access some rural hospitals, like in Sholo, that are pretty good, but are actually struggling because of a decline in demand. So that would help the veterans and also help the local community. But also recognizing that in a lot of places, there is just not the medical infrastructure, both in the VA or the private sector, to really serve some of these veterans in a timely manner. So that's why you need more things like telemedicine, and also allowing the VA, so if they're able to shift resources from an area where they're able to tap into the private sector, because they're giving veterans more choice, and you have more veterans going into the private sector either through choice or another community care program, then they could build out more resources to help veterans that are in more rural areas. Now, the bottom line is that in the next 15 years or so, 13, 15 years, you're going to see dramatic decrease in the veteran population, probably between 5 to 8 million fewer veterans. The veteran or the VA patient population is going to be much smaller and more dispersed. So the model the VA has of all these big medical centers, about 150 across the country, and then 1,000, community-based outpatient clinics, is not designed really well to serve the current veteran population and not the future veteran population. So you have to integrate it more with the private sector, and a key component of that is giving veterans options, because they know their health care needs better than anybody else. They know what is convenient for them and not convenient for them. And a VA bureaucrat, often sitting 100 miles away in another city, sometimes in another state, they don't know what's best for the veteran, and that's why choice is a huge part of what we advocate for. Now, we're not talking about, again, renewing the Veteran Choice Program and using that structure, because in a lot of ways, as I discussed earlier, it's just not working, and a lot of Montana veterans know that. But if you give them true choice, where they have that true portability of benefits, where the dollars are following them, then it gives them a lot of freedom, and it gives them a lot more options. And we're hoping to get there, and that's something we've been working on for the last few years.
Didn't Dr. Shulkin, the VA secretary, I've been talking to him today, and didn't he just throw into Congress, the Veterans Coordinated Access and Rewarding Experiences Act? Yes,
it's called VetsCare, and that proposal actually was put out in June, and they sent it just now to Congress. It's not in bill form yet, so this is him going to Congress saying, hey, these are some ideas. You know, there were some good things in the original plan, and there's still some good things in this plan. Some of the things they're working towards will hopefully solve some issues with care in the community. We think some improvements need to be made to it. We think there needs to be more choice right off the bat. Like, you should be able to select your primary care physician within the VA integrated care networks that they're proposing setting up, which would take a VA hospital system and then create outside providers that are connected to it. That we think was an important reform that would give veterans more choice and more freedom, and prevent some of the problems that you have where the VA is acting as the gatekeeper for all care. But it has some good stuff, and Secretary Shulkin and more importantly President Trump have been very open in saying, look, we want to get to a system that is better integrated with the private sector, and where veterans have choice, where they can go and make more decisions themselves and not have to go through the VA as a gatekeeper.
Well, let me tell you what our experience at the Institute is, okay? I work as a clinical suicidologist. What that is I've trained in mental health, but I also have gone and learned all the ways to put some programming in that we're doing at the Institute, like recreational therapist. In the last 5 years, I've done close to 3,000 clinical interventions for veterans that are in crisis. I've also counseled about 180, closer to 190 families now that have lost a veteran to suicide. Some of the issues that I keep bringing up and get ignored on. Example, last year, the VA did a study on veterans and published a report on this study. 81% correlation between PTSD and vestibular disorders. What does that mean? That means that there's a huge chance for the VA to misdiagnose PTSD because there might be a physical cause. When we've been working with the vets that we do diagnose there at the Institute, their PTSD symptomology can drop as much as 70% if they've been diagnosed with a vestibular and they get physical therapy and acupuncture. The VA bureaucrats sit there and call that experimental, but yet vestibular has been around forever. It's almost like saying, well, a sprain or a broken foot exhibit the same symptoms, but we're just going to call everything a sprain and treat it like a sprain because we don't want to x-ray. And when you bring up the bureaucrats, the union, how are you going to deal with that union that's going after it? That's a question I'm going to ask you.
Yeah, well, so the American Federation for Government Employees that represents about 250,000, actually more like 280,000 of the VA's employees, is a huge barrier to any type of reform. They have one objective. They might say they care about veterans. They might say that, they have a lot of veteran members. Their only objective is to maintain a large number of due-paying members, which means the only thing they will support is more money, more employees in the VA system. Even though that's what we have tried for the past 15 years since the War on Terror began, just buckets upon buckets of money in the system. We've added in the last 10 years over 100,000 new employees within the Veterans Health Administration alone. And that has really not done anything to improve access or wait times for many veterans. And yet here they are saying the only solution is that we need to hire every one of these what they say is 400 or 49,000 vacancies within the VA. It's a bait and switch, and they're building up a straw man argument. It's basically these vacancies, the VA either can't fill them or they don't need to fill them. And that number isn't even correct. It's much, much lower. And they want this to be the only solution. They don't want to go outside the box. They don't want to integrate the private sector better. You know, vet care is a very cautious approach to how to reform the VA. Again, I think there's some positive things in there, and they're moving somewhat in the right direction, but you need to improve it. But I think overall it's cautious. And they're even opposing that because they don't want any more care going into the private sector. They don't want veterans to have choice. They want those veterans to keep driving 5, 6, 7, 8 hours, because if they build something closer, through a community provider to their, to these veterans, or there's something available in the private sector, those aren't due-paying members for them. So they are a huge barrier. And I'm being very direct. I'm being very blunt here, but it's the truth. And they don't also think that veterans are smart enough to make their own medical decisions. They won't come out and say that right away, but if you read between the lines, that's what they're saying. They're in effect saying that you as a veteran, even though we entrust you to do things like drive multi-million-dollar tanks, lead men into combat, handle weapons that could take down airplanes, you're not smart enough to handle your own health care. So they are a huge, huge barrier to reform. In regards to the mental health issue and the VA spends upwards of $8 billion a year on mental health care. That's about $1,000, actually more, about $1,200 for every patient at the VA. And for Iraq and Afghanistan veterans, that's about $10,000 for each one in the system. And yet the VA still faces long wait times for mental health care in some places. And in other places, to be fair, they've gotten better. I don't want to place it with a broad brush, but in places like Phoenix and others, where I'm from, there are still longer wait times at VA medical facilities. It's been a huge money suck. And, yes, veterans, once they get in the system, they do have decreased rates of suicide. That's been proven. But you still have many veterans that aren't getting the access to the care they needed for mental health, and the long-term treatment plan just is not there.
Well, Montana's been at the high end of the suicide food chain for over 30 years, and nothing has changed. When we have a veteran in crisis, I have no place to put him, no place. Literally, the only place that we can put him in most cases is in jail. And that is just, I don't know if I can say the words that I want to say, but it's unacceptable. There you go. That's a good word for it. One thing that I'd like to do, Dan, is I'd love to have you come up here to Montana and see what the Institute's doing. We've been working for almost 5 years, and we're bringing a lot of this research to the table. And we're integrating it. We get veterans doing walk-ins on a daily basis, but yet we can't get we can get them to pay for education, but getting the VA, because of the Choice Act, the way it sits, we can't get reimbursed for all the medical services we're providing. Last year, it was over $600,000 in medical services that we gave away. Another issue that we keep coming up with over and over again, and we talked about this, is reforming the standard of care, because that's what these bureaucrats hide behind. It isn't the standard of care to do some of this cutting-edge treatments. Well, what's cutting edge about physical therapy for PTSD? If somebody is having a lot of issues, isn't exercise a really good value?
Yeah, and here's the interesting thing. Within DOD, they have different standards of care, and they're different from the VA, and they've been able to do some of these things within that system. Again, I want to be clear, DOD is not perfect. They have not themselves found the best way to treat some of this, but they've had more flexibility. One thing that they could do is standardize, the quality standards between both systems, and that would raise it a bit in the VA. That's an interim solution. That's something that they could do without Congress, possibly, at least in the short term, and that would help. But I want to zero in on this reimbursement issue because it's important. This has been the biggest problem with the choice program, is that the VA has been unable to do something which is one of the most simple tasks that any healthcare provider should be able to do, and that's bill people and reimburse people. And yet the VA has struggled with this I don't want to say it's simple, but it's a task that every major medical system is able to accomplish. Sometimes not all perfectly, but whether it's TRICARE, CMS, or your local hospital system, Kaiser Permanente, Cleveland Clinic, they've been able to do these things. The VA has failed to do it. And I don't want to put on a tinfoil hat and be conspiratorial, but some of it seems to be intentional by some bureaucrats because they didn't want this program to succeed. And you have fewer providers wanting to work with it. Work with the VA. You guys have been tremendously generous, it sounds like, in helping these veterans by taking them and eating the costs. But if you're running a business, a family, clinician, or you have an optometry business, for example, you can't afford to eat $1 million, $2 million in costs and stay in business. And that is a huge issue they need to solve in this. And you can talk about choice, which is important, and that's the key issue, but there's so many sub-issues underneath that broader issue of using care in the community the VA needs to address, not just reimbursement, sharing medical records. A lot of people say how the VA invented electronic health records. They did. About 30, 40 years ago, and then tried to fire the people that invented them on their spare time. But since then, they've completely fallen behind the times in their ability to share medical records between the DOD and the private sector. You got to fix that as well. If the VA is not going to pay people what they owe them, then people aren't going to work with them, and therefore veterans have less choice. And if VA is budgeted and given the money by Congress, there is no reason they shouldn't be paying them. In fact, the VA, in many ways, is in violation of the Prompt Payment Act, which was a law passed by Congress to ensure the government agencies are paying the private sector when the private sector is owed money. And the VA has been in violation of that, in effect.
No, I'm going to ask you this because we're running short on time here, okay? The Expanded Medicaid Act, I have gotten a lot of veterans care under Medicaid because they couldn't get care anywhere else. And I know that sucks, but we had to do something to get these guys, with cancer and different things, care. Why can't they follow what the Medicaid, Medicare is doing and has been doing since the 60s?
Well, Medicare through CMS, has a good model. Medicaid, in terms of reimbursing, I'm talking about reimbursements here specifically. They have a good model of reimbursing, and TRICARE does too. And the VA can learn a lot from them, but they have a very out-of-date IT system and a very expansive bureaucracy that is hard to change. And those veterans that are accessing Medicaid, they're priority group 5 veterans. They should be able to go to the VA and get payment to them, but obviously it's failing, so they have to go through the Medicaid program.
We're running short on time here. So, Dan, floor is yours for a couple of minutes here. What do you want to say to the veterans and the listening audience here in Montana? Well,
I would say that expect to see CVA doing a lot of great work in Montana in the coming years. Get involved with us. You can find out more about us at www.cv4a.org. You can follow us on Facebook at just search Concerned Veterans for America, and then follow us on Twitter at Concerned Vets. We are going to be very active in the upcoming months in the choice fight in ensuring that people like Senator Tester and Senator Daines and Representative Giaforte are doing the right thing in supporting choice. We look forward to working with all those members and moving them in the right direction on that issue. It's going to be important, and we need people to get involved and to be active, because I can do all these meetings back here in D.C., but if I don't have the grassroots backing me up, then we will fail.
Well, Dan, we appreciate your time. Are you going to be in Montana for a long time?
We plan to be there for a very long time, and we got a great staffer up there, and I look forward to coming out there myself in the near future.
Well, I appreciate your time this morning. Also, we will be informing you we are opening up a grassroots system called HEART, and when we announce that, we'd like to bring you back and let you talk to us about it, okay?
Sure, absolutely.
Well, I appreciate you coming into the studio this morning, Jesse, and I want to make sure that all of our listening audience gets out there and votes, and voting is coming out today. And appreciate your time, Jesse, and everything you're doing for vets.
Thank you very much, Ed. And win or lose, I look forward to working with you on veterans issues. And I just want the audience to remember that it's an all mail-in election, and it's a very important one. So make sure you get your votes out there and make your voices heard.
So thank you very much for listening to Veterans Heartbeat. We'd not be able to bring it to you without all the support of the listeners. And thank you again to Farside Signs for sponsoring the show. If you do need a unique vehicle design, swing on by and check them out. Also, thank you to our main sponsor, River. River has an array of services such as veterans-focused education, a vestibular disorder clinic, and now non-pharmaceutical treatments for pain, anxiety, and depression. Check them out on Facebook or on the web at riverofchange.org. Lastly, we'd like to show our appreciation to all of our veterans. Thank you for serving our country and keeping it safe.